And then here is my first mistake, okay? So I snip off one of the apexes of the triangles on the rubber stopper because that's where I know where this bend is going to be facing. And I can just feel like we're slipping in really, really nicely here. And that is the best feeling in the world. So hello, welcome to this week's clinical case, our Friday clinical case. And this is a really, really enjoyable case to showcase today, because when we ledge teeth, it's probably a really, really frustrating, well, it is the most frustrating thing that you can occur, bar fracturing a file, because usually when you ledge a tooth, if we're honest with ourselves, it's probably because it's kind of your fault, or you've made a little bit of a mistake. And when we say mistake, you've just made a misjudgment essentially, or sometimes it can be helped and sometimes it can't be helped. And I suppose in this particular case, I skipped a step, and 9 times out of 10 I skipped a step. I went from too high a diameter file too quickly, and 9 times out of 10 it's usually fine, but on cases like this, it sort of quarters out a little bit, and I suppose in a way it's placed at least 45 minutes extra onto the treatment time. But before we get into the case, before I showcase the case and I tell you all the particulars and things, what I do want to say is, when we look at the channel analytics, we can see that about 50% of the people who watch these videos are not subscribers. So if I could just ask you to do just one thing for me, and it's free, it's easy, takes half a second, that's just to subscribe. It supports the channel, and I promise you, if you subscribe, I will continue to do these videos every week, and the videos will get better and better and better. And if you want to bring your support even further for the channel, we've got a membership program on YouTube. It's a small monthly fee. You get early access to content. So we usually work about 3 weeks ahead. So you get 3 weeks worth of early videos, and also you get exclusive content. We've got an amazing endodontic access video on there. It's about an hour and a bit long, and it's got loads of videos that gives you all the information on how to access any root canal, and some tips and tricks on that. So we look at the case. This actually is when we found out about this tooth, it was actually an incidental finding. Initially, the patient was referred for a different tooth, a highly calcified tooth, and it transpired through that appointment that we took a cone beam CT scan, and during the report we found that there was a tooth which had apical infection, and also there was a missing canal. So this is a really, really common issue with lower incisors, usually with lower left tooth. This is a really, really common issue with lower incisors, and this is what we talk about in the access video is double canals. And what's a really, really important thing to do is when you're accessing these teeth is just to bring your access a little bit lingually, because there might be a cheeky little canal that you've missed. So essentially, we look at this case, and the obturation is not too bad on the buccal canal. It's still a bit short, but the main reason why this has failed is because it's missed a canal, and obviously there's space and bacteria that's remained. But if we move over to the video here, we can see that first thing to do is use rubber dam. In this case, I know the tooth is quite narrow, and I'm just using a succession of different clamps just to see if things fit or not. The first one's a bit loose, and then we use another clamp, and it fits a little bit better, but the jaws are a bit big. And then I know that there's another clamp that's got smaller jaws, and then we place that on nicely. And what I do like to do, of course, is I like to place the rubber dam clamp on with the rubber sheet at the same time. We've accessed the tooth here, and I'm just getting my DG16 probe, and I'm just having a little push around with this probe, and I can feel that the GP is slightly mushy, shall we say. And this is a slight concern, because if it's a bit mushy, using my sort of twist and pull technique with these headstrong files here, I don't know if I'm going to be able to pull out the GP in one, and it might start to come out in all sorts of nasty pieces. And actually, we can see here the headstrong file, when we pull it out, it looks like it's twisted in a way that's probably likely to fracture. So in this case, what I'm going to do is I'm not going to take a risk. The files are pretty cheap. I'm just going to place the file to the side and just get a new one. Don't muck around. You don't want to add a fractured file onto all your other problems. And essentially we're doing a bit more twist and pull, and I'm not really removing much of the GP at all. So I think what I'm going to do in this case is I'm just going to open up the orifice with some ultrasonic instruments. Sometimes when the access has got a little bit of a ledge and you're doing a retreatment of a tooth, these kind of like little ledges can kind of stop the GP being pulled out. So in this case, I'm just opening up the canal orifice with these ultrasonics. And the great thing about these, of course, as you well know, is that they remove small pieces of dentin, and it's in control, and you can see it quite well. We're going to do some more twisting and pulling with a size 25 headstrong filing. You know when you're pulling a piece of GP out, because it sort of feels a certain way, and I can see now that I have pulled some of the GP out, but I'm not too sure where the little piece is. And I have a little look around outside the microscope, and I can kind of see there's a fragment that's sort of been pushed onto the different part of the rubber dam. And this fragment is significant, but definitely not all of the GP, so we need to be mindful of that. And again, I'm just going to do more twisting and pulling with the headstrong file. Ideally, you want to take out the GP in large pieces, because if you mush this up, it's really, really difficult to get the sort of fragments off the sort of canal walls. And I'm feeling like I'm getting quite far down with this headstrong file, and I think what's probably best is for me to try and get a working length with my apex locator. So I'm just going to use a size 10K file here just to get a working length, and really easy. We get to the zero reading is 17.5 millimeters. So we've got the zero reading, and what I like to do is there's a bit of fragment in the GP, and I get to the zero. I usually just get just a succession of rotary files just to clean it out, the rest of it out. I'm going to use a 1403 glide path file, and again, this goes to length really, really easy. And then here is my first mistake. Okay, so I'm going to go from a 14 to a 25, and I think because the 14 went to length really, really easily, I think the 25 is going to shape this tooth really, really easy as well. And what you'll notice here is that I am getting resistance, and maybe you could argue I'm not really pushing this too hard, but I am putting a little bit of pressure on this tooth, and sometimes the file goes with a little bit of pressure, and sometimes it just sticks. And what I'm doing here is I'm creating a very, very, very small acute ledge with this high diameter file, but I don't know it yet. And I don't know it until I recapitulate. So, and what recapitulation is you're just getting a ham file into the canal space, usually the file that you've used to get the working length, and you're just going to try and keep it patent. And what I mean by patent is you're going to keep it open. And what I notice here is the file is not getting to the 17.5 millimeter mark, and that's a slight concern. So to overcome this problem, I'm going to do the easiest thing first, and that's just to make a small bend in the end of this ham file. So I'm trying to get a kind of bit of a quick fix here, and I'm just going to use you make a little tiny acute bend right at the end. I'm just going to adjust the stopper, because the stopper's got like a little marker on it, so I know where the bend is, and I'm just going to check the working length. Sometimes when you muck around with the stopper, you mess up the working length on the ham file. And then I'm going to introduce this hand file very, very slowly into the canal space. And what I'm doing is I'm on a little feel around, but I'm still not quite getting to the end. I'm maybe at like 17 or 16.5. So I might have ledged this tooth. Now, I don't know if I've ledged it because it's because where the two canals join or whatever. So I think what I'm going to do is I'm going to do the next easy fix, and that's just go down the lingual. We know the lingual's patent, or we think it is, because we can see on the cone beam CT. So I'm just going to use a size 8 here to try and negotiate down the lingual and to see. We know the buccal and the lingual join, and if I can get 0 on the lingual, then we know that I can fill this adequately. But as I try and shape with my size 8D finder here, I know that the lingual is quite sclerosed and calcified, and it's not really advancing. So I'm going to try and shape the lingual canal with a glide path file. I'm trying to open up that canal space to stop the file gripping. And then I get a bit paranoid because I feel like there's the glide path file made like a little clicking sound. So I'm just going to pull it out here and just check just to see if I've not fractured the file. I haven't, thank God. And then again, we're just going to do lots and lots of irrigation. I'm going to actually open up the lingual canal a bit further with a higher diameter file. I'm using a size 25 variable HyFlex here, but I'm not going to be pushing this like I did to length in the lingual. I'm just going to try and open that up, and then we're just going to do some more shaping. And then again, I pick up my size 8D finder and I try and negotiate to the lingual, but now with still no luck. So I wonder if the main canals, we say, is the buccal and the lingual's the one that moves onto it. And when we measure it here, I'm getting about maybe 16.5. So I'm going to change tack again. I'm going to go from the lingual back into the buccal, and I'm going to use a size 6 C+ file. These are a bit stiffer than your normal K files, and I'm going to just measure this to 17.5. I'm going to make again another small little bend in the end, and I'm just going to try and negotiate around the buccal canal to try and get past that sort of ledge that's been created. But I think that this C+ file is too flexible, and when we sort of measure the file here and we pull it out, we can see we're about 16 millimeters, so about a millimeter and a half away from the original 0 reading. Again, I'm getting a little bit desperate here. I'm just having another little feel with a C+ file 6, but again, I just feel like as I'm pushing this down, I can feel like kind of flexing at the end. So the 6 is too flexible. I'm going to go in with a stiffer C+ file, which is a size 8. Again, they've got a higher taper, so there's an argument to say that it's going to grip the file walls. But in this case, because I've got a bit of a ledge, I need the kind of stiffness there to try and negotiate past. But I'm still getting no luck at all. So what I'm going to do now is that I'm going to try and irrigate the canal space with 17% EDTA, because there might be a ledge, but there might also be a little bit of debris in the canal, which is stopping me from bypassing this ledge. And this EDTA is going to dissolve any kind of dentine chippings or whatever, or help us get to length a little bit. Again, I'm going to use this stiffer C+ file to try and negotiate to the end, and I'm going to use these Buchanan endo benders. So before I was using just normal tweezers to make a bend at the end, but these Buchanan endo benders, they make a nice kind of curve, less likely to fracture. And you can see here that I've made this kind of nice curve in this hand file, and I'm having a little feel around, doing a bit of watch winding, still no luck. And I'm kind of kicking myself now at the moment because, we're kind of half an hour in to creating this ledge. And again, always checking the end for breakages. That's really, really important. And also, I'm just going to rebend this hand file, because as you sort of negotiate with these files, the bend is kind of lost a little bit. And again, lots and lots of negotiation, putting that apex locator on to see if we're getting to the end, and we're not. And it's just use your patience. Try not to get too concerned. Again, I'm trying everything at the moment to try and get past this ledge. And I'm just trying with a size 6 and no luck. And when I pull this size 6 out, we can see that it's looking a bit funny at the end, and I'm a little bit worried I'm going to fracture this size 6 hand file. So I'm going to park that one, and then I'm going to go for my 8D finder. This is my size 8D finder. So we're going to measure it at 17.5. We know that's the 0 reading. I'm going to snip off one of the apexes of the triangles on the rubber stopper, because that's where I know where this bend is going to be facing, and I'm going to just make a quite an acute bend with my Buchanan endo file benders here. I'm going to just be, again, super careful, watch winding. I'm going to just introduce the hand file into the canal. I'm going to be super careful, just a little bit of watch winding, little bit of movement around, having a feel for the catch, and I can just feel like we're slipping in really, really nicely here, and that is the best feeling in the world. Bit of zen, nice one. So we're in. Worst thing to do now is pull out. What you want to do is you want to just check the working length just to see that we're at 0. We are at 0, so we know we're at the end. And then we're going to stay in. I'm going to do a bit of watch winding in and out to kind of shape that ledge out. Don't pull it out straight away. Lots and lots of irrigation. If you're creating debris, you want to flush that all out. And then once we have shaped with our size 8. We're going to try and go in with our size 10, the same preparation. We're just going to cut the stopper, make a small bend at the end. And what you'll notice here, that I push this size 10 to length, and I can't get 0 again, so my heart drops. And what I am going to do here is I'm going to try a smaller, stiffer file. I know that the original size D finder that I used was a size 25. I'm going to try and use a size 21 in this case. It might give me a little bit more stiffness, but actually when we put it in, it doesn't go to length either. So I'm thinking, oh my God, was this just a one-off? So I go back to the original file, and this was fine. So, you know, I suppose in a way you've got to ask yourself, why is this file going to length, but another size 8, which is smaller and stiffer, isn't going to length? And when we look at the ends of the two files here, the yellow one is the original. We can see that this has got more of an acute bend. So I'm just going to prep the smaller size 8 D finder with a more acute bend, and in fact that goes to length. So just you know, if you're trying to problem solve things, just try and think about things in the most logical way. And again, you know, I use the same sort of principle here with the size 10, and I, you know, I muck around a little bit, but I actually put quite an acute bend in this size 10, and this actually goes to length really, really nicely. So that is the most significant thing. The problem I'm thinking of now is, how am I going to get my normal rotary files past this bend? And I suppose in a way I could say to myself, well, I'm going to attempt this, but I'm not going to be using a high diameter. I'm definitely not going to use that size 25. But what I am going to use is I'm going to use these size 12 D finders to try and go up in diameter in a really, really small increments. And the size 12 is an unusual shape. You're probably not used to a size 12, but this stops that kind of difficult transition from a size 10 to a size 15, because essentially going from a size 10 to a 15 is you're going 50% up in size. So this size 12 is going to try and help us transition from the size 10 D finder, which we usually use, to the size 15 glide path. And I'm going to just try with the glide path file here, and the shaping out of the ledges essentially is hopefully going to make sure that this glide path file goes to length. And what I am going to do is I am going to manually place this glide path file in the canal and try and negotiate it and get past this canal. And I'm using this rotary file manually, and I can't quite get to length. So I'm just going to adjust the rubber stopper here, and I'm going to pull this out, and I'm just going to measure how far I've got. And again, I believe the ledge is at about 16 millimeters, because I keep getting this 16 millimeters measurement. And I'm going to change tack again, but in this case, I'm actually going to go for a higher diameter file. I'm going to use a size 20 HyFlex. And believe it or not, the difference between the size 20 HyFlex and the size 15 HyFlex is flexibility and shape memory. So the 15 actually doesn't keep its shape memory, but if you bend a little size 20 at the end, it'll keep its shape. And the great thing about this is you can you know, if you've got an acute bend right at the end, you can put a bend in the end of this 20. You can then just very, very manually bring this file to length. And you can see that I'm just passing the ledge there, because it's getting to the stoppers at 17.5. And then what you can do is then you can just put the handpiece onto the file. You don't have to lock it in place, and then you just shape it out. Of course, you've got to be very, very careful about fracturing the file in this case, because the file is off in the canal, and it's obviously around the ledge, and you're just putting this pressure on straight away. But I'm quietly confident that I've shaped this canal quite nicely with the size 20, which is great. We've gone from not being able to shape 1.5 millimeters away from the 0 reading to we've shaped it fully. But, you know, look at how many files I've had to use to negotiate past this ledge. So what I would say is sometimes it can be helped, sometimes it can't be helped. But if you can try and reduce the risk of ledges, it just stops all the files that we've used, and obviously wastes about 45 minutes to get past. But And essentially, it's the same shaping protocol for the lingual canal. And luckily enough, in this case, we've taken a cone beam CT scan. And unlike normal periapical radiographs, the cone beam CT scan has got quite an accurate measuring tool. So I know exactly where these two canals join, and I can just shape up to that point. And we know they join because when we go for the obturation sort of flows out of both canals when we inject it into one canal. We're then ready for our cone fit radiograph. And I always like to check my GP cones to see if the apical the diameter at the end are correct. So I've got this gutter cutter here, and when we have a little check, we can see that the end of the GP is actually at 20, which is quite reassuring. We're then going to measure the GP cone at 17 millimeters, and we know there's an acute bend at the end of this canal space. And so what I'm going to do is this cool little trick. I'm going to make a little bend at the end with my GP cone, and then I'm going to use EndoFrost, which is what we use for vitality testing, to freeze the end of the GP cone so it's stiff. So then once I have frozen the end of this GP cone, it's then going to keep its shape so I can kind of negotiate past this kind of ledge, which is about 16 millimeters. So we give it a really, really good sort of spray with the EndoFrost, freeze the end, and then as we sort of introduce this GP cone, we can see that it's kind of slipping really, really, really nicely to length, which is lovely to feel. So we know that the bend actually sits buccally in this tooth. What I do like to do is I like to do a little bit of tug back on teeth, and also I like to check the sort of working length to see if we've got to the end. But in this case, I don't want to pull it out because I know I've more than likely slipped to length. So rather than pulling out the GP cone to see if you are at length, because we're worried about length control, what I'm going to do is I'm going to get the excess GP, which I've just cut off, and just get another GP cone and crimp it at that point. And then I'm going to use this new GP cone and just measure it to see if we are actually at the correct length. And we can see here that we are at 17 millimeters, which is really, really nice. I'm then going to use the same GP cone just to place in the lingual canal, and then when we take the cone fit radiograph, we can see that we're really, really nicely at the kind of correct working length. It isn't at the radiographic apex, and I think this is because there is an acute bend in the apical third, and this is genuinely at the genuine portal of exit. And when the cone fit radiograph is getting developed, I'm just going to prep our endo disinfection ring. I'm going to use we're going to use isopropyl alcohol in one of the wells. We're going to use EDTA, and then we're going to use sodium hypochlorite, and then we're going to get a hand file ready for this to be introduced into the canal space to place the bioceramic all the way to the end, and this is going to be disinfected. Once we have taken the cone fit radiograph and we're happy, we're going to pull the GP cones out. We can see that some of these GP cones are not great at the end. There's a little bit of a bent at the end, and that's a slight concern for me, especially when we're trying to push these back to length. So we're just going to place them in a disinfecting ring, and we're going to do our final irrigation protocol, which is sodium hypochlorite activated. Then we're going to use it's 17% EDTA activated, and our final rinse with sodium hypochlorite. And then we're going to do some paper point drying and make sure that the both canals are really, really nice and dry. And then, as I'm doing this final irrigation protocol, I'm thinking maybe the GP cone, which is bent at the end on the buccal, is probably not great, and we're going to have to use another GP cone. And this is a bit risky to do this, because that one of the GP cones is actually genuinely the correct length. But I think in this case, the end of the GP is probably we're gonna find it difficult to sort of reach around that sort of bend again. So you can see here that there is a small bend in the GP on the top one, but I think that when you put this back to length again, it's gonna be it's not gonna go back in the same position. So it's very risky. You've got to ask yourself, will it fit? But same again, we're going to prep the GP cones, we're going to place them in isopropyl alcohol, we're going to dry them off. That gets rid of all of the sodium hypochlorite residue. We're going to load the sealer. I'm then going to bend the end of the GP cone again, freeze it with EndoFrost. We're going to fill the canal with a bioceramic sealer, and then we're going to place the cones to length, nice and easy. When we check the post-op radiograph, looks great. Looks really, really, really nice. It's to length. I'm really, really happy with this. And overall, you know, this is the kind of things you go to work for, don't you? You know, you encounter problems, and when you overcome them, it's really, really satisfying. I'd like to thank you for watching the video. If you have any comments or criticisms, you feel like you could have done something differently, please comment in the video below. Again, please like and subscribe, really, really important. And if you want to join our membership program, it's a small monthly, you get loads and loads of little benefits. And I will see you in the next video. Bye-bye.